Hello everyone, I'm Dr. Raznick, one of the infectious disease specialists here at UT Medical Center, along with my colleague Dr. Megan Edwards.
Hello. Today we'll be talking a little bit more about the COVID boosters and why it's essential to receive these.
So what we are seeing right now with our COVID response is that things are much better than they were during our peaks in August and September of this year, but we still have a substantial amount of COVID-19 transmission in our community, and we're going into the holidays with a lot of family gatherings and other social events on the horizon in our community in the setting of an emerging COVID variant called Omicron. That gives us reason to be concerned that we need to take every step we can to protect ourselves and our community.
I agree completely that we need to make sure that we are at our best going into respiratory virus season. And unfortunately for now, COVID is one of those respiratory viruses that we're going to have to continue to pay attention to. Nobody wants to have to get another shot, but it's one of those things that we do for ourselves, for our families, and to keep our patients safe.
It's been a while since your body has seen the COVID-19 proteins from your vaccine. And just like with anything, if it's been a long time since you've exercised, you're not going to be as strong as you should be to face a challenge. And it's the same with your immune system. If it hasn't been exposed to the COVID-19 through vaccination or prior infection in a while, its response is going to be a little weak. And so think of this as a way to really exercise your immune system, build up its strength as much as possible in the face of possible increased transmission through the winter or encountering this new variant.
What we are seeing right now out of South Africa is that the patients who have had COVID or have had vaccination who receive a booster have more than 2 times the amount of antibodies as those that did not. So that's the big piece of why we are recommending getting boosters so quickly. We know that the vaccines are going to protect us against Delta. We're worried right now that this new variant may throw a wrench in that system, and this is one way that we can fight that.
The beautiful thing about the vaccination is that it's widely available in our community at present. We have the vaccine clinic here at our medical center that is open with walk-in appointments available every day of the week. We also have many community resources such as vaccinating pharmacies, and even some acute care clinics are providing COVID vaccination at no cost. You know, we've talked a lot about boosters, but I think it's really critical also for those that haven't yet taken that first step for them to get the vaccine.
Anytime that you have questions about your health, the first person that we encourage you to talk to is your primary care provider. This person knows you the best and has your whole medical history at their fingertips. And lastly, there's the infection preventionists who are skilled in answering these COVID-19 questions.
And in light of what we've heard about Omicron, the fact that it is moving so fast, we know that your immune system can move faster if you get it vaccinated now. You can certainly have that protection before we start to see Omicron arrive in a substantial amount in our community.